Hi everybody, my topic is Prader-Willi syndrome. Prader-Willi syndrome affects 1 in every 15,000 births. PWS affects both males and females as well as all races and ethnicities. Prader-Willi results when the genes in a specific part of the 15th chromosome do not function. This may be a result of a random error during development of the fetus, but it is sometimes inherited. Prader-Willi syndrome in infants is characterized by diminished muscle tone, poor sucking and swallowing reflexes, which results in feeding difficulties, failure to thrive, to grow and gain weight, a weak cry, and facial features include a narrow forehead, almond-shaped eyes with upward slanting eyelids, a downturned mouth. Sometimes the hair and skin of the child the coloring is often lighter than those of other family members, and they also may be delayed in walking, sitting, and talking. In childhood, poor muscle tone often leads to speech problems. The children are short in stature and they often have small hands and small feet. They have genital abnormalities which often delay puberty, and sometimes they are sterile, but not always. The children have an excessive appetite, and this causes obesity most times because of a lack of feeling satisfied after finishing a meal, thus leading to overeating. PWS is recognized as a common genetic cause of childhood obesity. Without appropriate treatment, those individuals with severe obesity often have a high risk of cardiac insufficiency, diabetes, or other severe conditions that could lead to life-threatening difficulties. All individuals that suffer from Prader-Willi syndrome have some cognitive impairment that ranges from borderline normal with learning disabilities to mild mental retardation. They commonly battle behavior problems that would include temper tantrums, obsessive-compulsive behavior, skin picking, and difficulty controlling emotions due to a delay of emotional development. These people are often fatigued because sleeping patterns are regulated by the hypothalamus, and children require naps, and adults often are prone to daytime sleepiness. The hypothalamus also controls temperature, and often erratic behavior is common in extremely hot or cold temperatures. There's a high pain threshold, and the children easily bruise, so activities have to be carefully monitored. Some other issues are visual impairments and scoliosis. These are very common in PWS. Specific learning disabilities. They had difficulty with auditory processing, and this is a result in having difficulty understanding verbal instructions or receiving too many instructions at once. Often questioning is repeated on the same topic. There's stubbornness that can be attributed to difficulty with sequencing and processing. They're rigid thinkers. This is what is learned will be difficult to unlearn. This form of concrete thinking makes it difficult to follow a line of logic or learn from experience. They have poor short-term memory. What is learned one day may be forgotten the next week. Some hints for instruction. Repetition is necessary due to poor short-term memory. The task should be small. If a task is too difficult, a child with PWS may refuse to carry out or have an outburst of temper tantrums. Fine motor skills are oftentimes far more developed than gross motor. These children have trouble with imaginative writing. They work better on tasks that involve their own personal experiences. A child with PWS does better with one-on-one instruction. It's difficult for them to work in groups, and they require extra support under these conditions. Like all children, those with PWS have a higher potential to succeed if their efforts are acknowledged and praised. They will continue a task if they feel well motivated to do so. When thinking about inclusion in the regular classroom, when looking at numeracy, you must emphasize on small steps and relate mathematics to real-life concepts. It's much too hard for these children to focus on abstract concepts. When looking at literacy, literacy is generally reported as a strength in individuals with PWS. Writing might be affected by poor muscle development and motor control, but reading is considered as an opportunity to excel. Individuals with PWS usually learn words by sight and not phonemic awareness, like sounding out words. They do better with sight words. Direct instruction in reading needs to include helping individuals. Direct instruction in reading is used to help individuals develop the necessary reading behaviors, like for decoding words and reading comprehension. When you're looking at, the other important part of involving these children in the classroom is positive behavior support. These children have a lot of problems at home and in the community and in school settings with having inappropriate and disruptive behaviors, such as tantrums, stubbornness, various compulsive behaviors. And teachers and parents they find it hard to prepare themselves for these. So effective behavior change must not only reduce inappropriate behaviors, it must also teach suitable alternatives. These changes should not only help the individual in the immediate environment or the short term, they must also be important for life after school or long term. A lot of functional behavior analysis should be done, antecedents for why behaviors occur, and management of consequences are important. In summary, PBS tries to change the environment so that the conditions for appropriate behavior and its reinforcement are available to teach appropriate behaviors as a substitute for assessing reinforcement in the environment. And parents are able to work with their children using techniques that are effective and at the same time part of a normal pattern of interaction. From the perspective of school, PBS is a good match because of its suitability for use in inclusive settings and because it's primarily a teaching method. Positive behavior support is a procedure more likely to encourage the inclusion of children with disabilities in general classrooms. Some resources for teachers are the NORD website, and there's also Foundation for Prader-Willi Research and the March of Dimes, and Prader-Willi Syndrome Association. And also there was a book called Prader-Willi Syndrome, A Practical Guide. This has a lot of resource materials for teachers and including the children in the regular classroom. So that's it.